Well, in the business behind medicine, coming up next, I talked with one of South Florida's top sinus and allergy experts, Dr. Suresh Raja. And in an interview taped earlier, I asked Dr. Raja what the latest innovation he practices for sinus relief.
Well, besides the balloon sinuplasty, I would say that we're doing image-guided office surgery in the near future, and we also are doing medication-infused dissolvable implants for people's sinuses as well.
Implants,
Yes.
yeah. Well, you're state of the art at the forefront of the sinus situation in South Florida. You went out to Silicon Valley. What happened out there with that?
Well, David, it's nice to be using technology from a place like Silicon Valley. It just feels different. The company that makes the devices is based out of Menlo Park, and as it were, the company that makes the infused implants is right across the parking lot. Yeah. And it was just an incredible experience to see what they have to do to bring a product to market, and all the different regulations they have to pass, and all the beautiful engineering that they have to do.
Yeah, from the FDA, that sort of thing. Well, you're transitioning from the operating room in a hospital to your office. How is that developing?
I think it started with the balloon sinuplasty again because it was the perfect procedure, well suited for this transition, but it's something that's been happening slowly. We just want to make sure that our patients are very safe and comfortable even as this transition is occurring.
Yeah.
But as a rhinologist, I think in the next year there won't be anything that I can't do in my own office that I would require an operating room for.
Well, we want to make sure, outside of the hospital operating room into your office, it is completely safe, I understand, on this situation.
Well, we want to take all the precautions that we can. We are not obligated in our office to have a licensed level 2 surgery center in our office, but we have it, and we've had it for a number of years, and that allows us to do things in the office very safely and very comfortably, and we just move from there.
Yeah, boy, and I'll tell you one thing, it's a lot less costly for the patient and
It is. Patients have their deductibles. I think patients have become very savvy consumers of healthcare, so they understand their deductible. You're right. They understand the time off from work. They understand the recovery. They understand all the different bills that you might get from the anesthesiologist, from the pathologist, from the facility. So it's better for everyone.
Do you find that your patients look online to discover what's going to happen?
Yes, very much so. Even if for any malady, not just sinus disease.
Yeah, I can see that. I know, boy, I look online before I go. Of course, I haven't. Self-diagnosis is pretty bad.
Well, I think if it's not your field, you should be careful doing too much Googling.
Well, doctor, you're highly specialized in this. In South Florida, is this any different with the sinus situations than across the country?
I think we've talked about this before, David. A lot of it is about mold. We're in a subtropical climate, and there's a lot of mold here. And over the 15 years that I've been practicing here, I think mold is a big driver of sinus disease. And you have the indoor type, which comes from air conditioning and water anywhere in the house if there's a leak or something like that. And then you have the outdoor type. But I would say allergies is also right up there. We are entering the 3rd year in a row of severe allergies. We've had a very warm winter with very little rain, and the sugarcane crop was a really boom year.
Does that affect?
That is. So I think we're heading.
That was just in April, last month.
Right. So I think it was the 3rd largest in the 60 years that they've been keeping track of it. So things are growing, and things grow here all year long.
Oh, gosh. Well, listen, taking a step back, how did you get involved in this unique practice?
I think it's just luck. I think my father is an ear, nose, and throat doctor, so that's how I was interested in the field. But I think I've always been an early adopter, and being in New York City at the time that I was, when some of the really key tools of the trade came out, meaning computer image guidance systems and what was the way we used to do surgery, something called the sinus shaver or microdebrider. All of those things came out while I was still in training.
Yeah.
So I was able to really just latch right onto that and then continue with each generation of progress that we've made.
Well, where'd you go to med school?
I went to New Jersey Medical School in Newark, New Jersey. I had a wonderful training there.
Yeah, that's great. Well, you got 3 offices here in South Florida. and you're running all over the place taking care of patients. This is terrific, you know.
Thank you, David.
All righty.
Thank you.
Good luck, Dr. Raja.
Thank you very much. Thank you for having me, David.
Yeah. Thanks for explaining all this situation to us.
Oh, no problem.
All right, thanks, Doc. And stay with us. We'll return right after these words.